I read this really great question today on r/mental health. Why are so many people who work in mental health cold and careless? I don't know. I've been asking myself this for years since my first therapy appointment more than 10 years ago now. At this present day, I work in the mental health field as a recovery pair, and I still find myself wondering that about my coworkers now, as opposed to my own personal psychiatrist or therapist or social worker. And it's the immediate contradiction of what the reality of going through the mental health system is like and what the general public thinks it's like. A lot of us conjure in our minds that therapy is a safe space. And that's true if you're in a certain tax bracket. But for the people who have to rely on understaffed clinics and hospital wards, that's far from the truth, to be perfectly honest. At my first job as a peer, I worked for this program that worked with adolescent clients. And one day in our clinical staff meeting, we were talking about our high risk patients, and high risk meaning they're either in the hospital or they're not complying with the treatment, whatever. And the psychiatrist brought up one particular person who was struggling with taking medication. They were on Vega at the time. And the director of the clinic, who was sitting in with us, said, who was also I don't believe they were practicing psychologist anymore, but had an MD, and said, oh, that baby dose of Invega, why are they struggling with taking a dose so small? And I just remember the rest of even the therapist, the team lead therapist, and everyone getting so quiet because we just couldn't believe that the director of the program was so careless, so callous. And it just wasn't that instance either. There's been so many instances where I've worked in substance abuse clinics, inpatient detox, outpatient, and it's just you always find one person on the team who is incredibly jaded. I think the simplest answer I can give is not a lot of people have empathy. Period. Especially in this field. This is a job. You go to the office, you get your paycheck, and you go home. The hard answer is that we as a society cannot grasp the totality of people who struggle with mental health. Patients, clients are either seen as successes, quote unquote, or failures, quote unquote. Because a doctor or a therapist is seeing the individual at their worst. The other sides of that person, like them being a friend, or maybe a creative, a daughter, a son, a mother, a father, is completely lost on them. And it's very easy to get jaded in this field as much as it is to get heartbroken and lose your mind. I uniquely don't seem to have this problem, mostly I think because I don't infantilize my clients. I don't even like calling them patients because, I'm a peer, so we're on the same level. I'm just doing a little bit better. I'm just doing a little bit better than you. I'm a little bit ahead because I have a job. But I believe they have the power to change their lives if they want to or not. And that won't change my perspective on them because I know they are struggling with an illness that's separate from them as a person. And I struggle with an illness as well, so I understand of myself. If anything, anything, I've always had an issue working with neurotypicals, and I'm completely jaded towards them and their ability to understand people with chronic mental illness. Doctors and therapists I have worked with as a coworker or as a patient of theirs tend to have this attitude of willpower. Do they lack it? Can they overcome their chronic illness? Which, that is not the reality of chronic illness. You'll have good days, you have bad days, and sometimes it's not even a reflection of yourself, like if you took your meds, or if you ate poorly, or I don't know, something can just happen. Someone can die. You could wake up and like things can compile in your life and you wake up and then you're just numb, then you're just symptomatic for whatever reason. And unfortunately, when that happens, the person becomes a quote-unquote failure or someone who lacks willpower. That's when you start to get the distancing and the coldness from that, provider, whether they're a doctor, social worker, therapist. But also, in their mind, they're protecting themselves from your inevitable failure, or what they think is your failure. Could be a relapse, could be another hospital stay. There's also the other side of it where a person is really, really passionate about helping people. Maybe they had a family member or a friend who struggles with chronic depression or schizophrenia or suicidal ideation. And they just want to be that light for somebody, that light that they couldn't be for that other person. And their hopes are dashed when a client keeps canceling or just starts to give up hope in general. All that can weigh heavily on someone, especially as a peer, because there's not that clear boundary that you have with a therapist or psychiatrist. You're more their friend than anything. Sometimes you're their closest supporter. And this is not a video excusing the coldness and callousness of these workers. I just wish, that there was empathy in the field and the system we work in wasn't so sterile, and that people could sit and be comfortable with someone's struggles. I remember the first time I was an inpatient, and it was the first time that I was around people who, like, for extended amount of time, around people who, were dealing with depression, schizophrenia, bipolar disorder, whatever. And, I could sit and talk with them, which I did a lot, which is very unusual. But that's what I did. I would go and I would talk to people. And the thing that was so cathartic for me and what was so helpful about being an inpatient is that you had like an understanding that you weren't, like, you were drowning or you're dealing with this illness, but you're not alone. Like, you don't feel completely insane because there's someone you're sharing a room with or that you're eating next to in the cafeteria who is going through a similar struggle than you. And I remember my roommate at my first visit, we started just talking about like depression and why we were there to begin with, and like what kind of led up to our lives there. And it was such a great conversation for us. And then all of a sudden, the person who I was rooming with, like, they were on watch and for like ideations and stuff, because that's why they had come to the hospital in the first place. So they had like a nurse or a behavioral worker watching them for the most part, like just in the room with us. And she's like listening to our conversation, and at some point she kind of interrupts and she goes, you ladies shouldn't be talking about this. You should think positive, happy thoughts. That's why you're here in the first place. And we both got really quiet. But what I really wanted to say was, this is actually very helpful to me. This is more helpful than, the group therapy where the psychiatrist is just talking about like theory or whatever. And I mean, even in group therapy, like the moments when people got to speak and say how they felt and why they were there, those were like the most impactful moments for me. So with that nurse, right? Like or that behavioral worker who had interrupted us, in my opinion, she was being very dismissive, saying cliche lines like, you just have to think on the positive side. But unfortunately, sometimes there's no positive side. You are at your rock bottom. You're in a shitty situation and you just need someone to see you. But they don't want to see you because it hurts or triggers something inside of them that makes them shut down. I think the system taught me how to advocate for myself. And that's one of the passions I have, teaching other people to do the same. Because no one is coming to save you. And that sounds really rude and messed up, but I don't know. That was my reality anyway. Maybe I shouldn't say that. There are definitely people, angels who show up in people's lives and change their lives for the better. And I do think reaching out for help, even if you don't get the exact thing you needed, is a step in the right direction. And it's healing. It's very healing. Because you're putting yourself first, and that's, I think, in my opinion, the most important step in learning to manage chronic illness. I don't know, what do you guys think? Let me know in the comments. Like and subscribe for more whatever this is.